we're going to be looking at the pros and cons of Wegovy. As many of you know, Wegovy is one of the sensational medications in the past few years for weight loss. A lot of people get prescriptions for Wegovy, and it's flying off the shelves. Even there are times when the manufacturer cannot meet up with the demand. But today I want to go over the pros and cons of Wegovy. So I'm going straight to their website, so it's not going to be that somebody's just saying what they like. I'm going straight to the manufacturer's website. And if you want to find it yourself, go to wegovy.com. Now, from my experience, a lot of customers come and say, oh, it's working. I'm losing weight so fast. So that is part of why so many people want it, because, it seems that they are losing the weight remarkably, which is good, because sometimes when you lose weight, and most of the times when you lose excessive weight, it helps with your health. There's so many health conditions that are related to being overweight. So yes, that's a good thing. It's helping you to lose weight. From the website, you can see that it helps to improve, it lowers the risk of major cardiovascular events, that's heart-related events. And then it helps with blood sugar. It helps with so many things. So when you go to wegovy.com, you'll see a lot of that. So let me just read what they have on their website for you. So that it says Wegovy injection 2.4 milligram is an injectable prescription medicine used with a reduced calorie diet and increased physical activity. So remember what they're saying there. So the fact that you're using Wegovy doesn't mean you're supposed, according to the manufacturer, doesn't mean you're supposed to eat anything. So they still want you to reduce your calorie diet, and they want you to increase your physical activity. This is something very major, because if you reduce your calorie diet and increase physical activity, even without using any medication, you will see some weight loss. But probably Wegovy makes it very fast. And what are the pros? It will reduce the risk of major cardiovascular events such as death, heart attacks, strokes in adults with known heart disease and with either obesity or overweight. And then also in children 12 years or older with obesity, it could help with overweight. And they say that you will lose the excess body weight and keep the weight off. Okay. So I agree with that. Weight loss is good, but at what cost to your health? So that's where I come in with the cons. What are the disadvantages of Wegovy? And that is where I want us to focus on today. Yes, it's good to lose weight, but at what cost? So first, and this is from their website. It says Wegovy may cause serious side effects, including possible thyroid tumors, including cancer. Okay, now what they are saying here, and I will read it to you. They did some studies in lab animals, and they found out that a lot of the lab animals had developed thyroid cancer. It seems from their website, it seems as if they did not see this in human beings. They only saw it when they did their animal clinical trials. However, they had to report it. So the one I'm going to read here, I don't think they really saw it in human beings, but I will still read it to you. It says, it may cause possible thyroid tumors, including cancer. Tell your healthcare provider if you get a lump or swelling in your neck, hoarseness, trouble swallowing, or shortness of breath. These may be types of thyroid cancer. In studies with rodents, WEGOVY and medicines that work like WEGOVY caused thyroid tumors, including thyroid cancer. It is not known if WEGOVY will cause thyroid tumors or a type of thyroid cancer called medullary thyroid carcinoma in people. Do not use WEGOVY if you or any of your family have ever had a type of thyroid cancer called medullary thyroid carcinoma, or if you have an endocrine system condition called multiple endocrine neoplasia syndrome type 2. So that's the warning. Now, if you now go to here, there's possible side effects. Now, when we go to possible side effects, these are side effects that have actually happened in humans. The first one, I said it didn't happen in humans, but where you see possible side effects, these are things that have happened in human beings and they are required to report it. So that means that if you use WEGOVY, there's the possibility that you could have one or more of these. So let's go into that. WEGOVY may cause serious side effects, including inflammation of your pancreas. Stop using WEGOVY and call your healthcare provider right away if you have severe pain in your stomach area that will not go away with or without vomiting. You may feel the pain from your abdomen to your back. Another one, gallbladder problems. WEGOVY may cause gallbladder problems, including gallstones. Some gallstones may need surgery. Call your healthcare provider if you have symptoms such as pain in your upper abdomen, the upper stomach, fever, yellowing of the skin or eyes, or clay-colored stools. You could also have increased risk of low blood sugar. Now, this is something that's common to most medications that lower blood sugar. So it's not common just to WEGOVY and medications like WEGOVY. The thing is, if you take two different medications that are lowering your blood sugar, and then if you are also taking less sugar, you might end up with low blood sugar. So this particular side effect I want to say now is not just for WEGOVY. So if you are diabetic, or even if you are normal, if you don't have enough sugar in your blood, you could have this condition. So increased risk of low blood sugar, especially those who also take medicines for diabetes such as insulin or sulfonylureas. Those are things like glipizide, glyburide, and so on. Saying this can be a serious side effect. Talk to your healthcare provider about how to recognize and treat low blood sugar and check your blood sugar before you start and while you take WEGOVY. Signs and symptoms of low blood sugar may include dizziness or lightheadedness, blurred vision, anxiety, irritability or mood changes, sweating, slurred speech, hunger, confusion or drowsiness, shakiness, weakness, headache, fast heartbeat, or feeling jittery. So as I said, this side effect happens in many medications that reduce your blood sugar, but it also happens with WEGOVY. Kidney problems. In people who have kidney problems, diarrhea, nausea, and vomiting may cause a loss of fluid, and that means you'll be dehydrated, which may cause kidney problems to get worse. It is important for you to drink fluids to help reduce your chance of dehydration. Then, some people have serious allergic reactions to WEGOVY. Stop WEGOVY and get medical help right away if you have any symptoms of a serious allergic reaction, including swelling of your face, lips, tongues, or throat, problems breathing or swallowing, severe rash or itching, fainting or feeling dizzy, or very rapid heartbeat. Change in vision in people with type 2 diabetes. So some people with type 2 diabetes experienced change in their vision. So tell your healthcare provider if you have changes in vision during treatment with WEGOVY. Another side effect, increased heart rate. WEGOVY can increase your heart rate while you are at rest. Tell your healthcare provider if you feel your heart racing or pounding in your chest and it lasts for several minutes. Then this one is a very bad one, depression or thoughts of suicide. You should pay attention to any mental changes, especially sudden changes in your mood, behaviors, thoughts, or feelings. Call your healthcare provider right away if you have any mental changes that are new, worse, or worry you. So these are possible side effects with WEGOVY. So weight, these are the pros, these are the cons. So would you want to just reduce your calorie intake and exercise, or do you want to add WEGOVY? This is a choice for you. Now, so those are possible side effects. Now, the common side effects, which almost everybody, at least a large percentage, not almost everybody, but a large percentage of people who use WEGOVY have these side effects: nausea, diarrhea, vomiting, constipation, stomach pain, headache, tiredness, upset stomach, dizziness, feeling bloated, belching, lower blood sugar in people with type 2 diabetes, gas, stomach flu, heartburn, and runny nose or sore throat. This is from the company's website. When the doctors are prescribing this, most of them don't emphasize all this because you don't have much time in the doctor's office. And then you're putting pressure, okay, the pharmacist gets the prescription and we fill it. All this information is in the package insert of WEGOVY. So it's not as if they've not told you. But sometimes people tell you things, but you just look at the good side. Unfortunately, some of these side effects are not quickly reversible. So it's not something that, when I stop WEGOVY, everything goes back to normal. Sometimes it's not that easy. So before you race to go and use WEGOVY or any medication for weight loss, first, try reduce calorie intake and exercise. Because even these medications, even the manufacturers tell you to add that to the WEGOVY. So why not try reduce calorie intake and exercise first? Now, I know it's easier said than done, to reduce calorie intake. But find out, what is it that makes you eat more than you should? Maybe if you spend some time trying to find out, maybe that will help. If it's boredom, look for something to do so that you don't eat too much. If the foods are always in the fridge, don't buy them, so that you only buy healthy foods, so that when you feel peckish, you will feel like eating something, you only find, healthy things in your refrigerator or in your food cupboard. So that just today is telling you about the pros and cons of WEGOVY. WEGOVY, a lot of patients have told me it works. And one more thing, the manufacturers of WEGOVY know about these side effects, and sometimes, or most of the time, in fact it's required, you don't go straight to 2.4 milligram. So you first start at 0.25, go up to 0.5, then 1 milligram, then 1.7, before you get to 2.4. So this is to help reduce these side effects. So it's not as if they are not being responsible, but I just want you as the general public to have enough information to decide, do I want to go for WEGOVY or do I want to try something first before jumping straight to a medication like Wegovy. If you have any questions, please put it in the comments, and thank you for listening. Again, this video is informational only, and it is not, you're not to stop your medication without seeing your prescriber, but this is for your information so that you can make an informed decision on whether to start this medication or not. Thank you.